Okay, this is part 2 of the disorders of the immune system, and we're going to start with type 3. These are called immune complex reactions, otherwise known as Arthus reactions. And this is something that happens when your body, you make these immune complexes. So antibodies will bind to antigen, but then sometimes the antibodies coalesce together like this. And this is normal, right? We talked about agglutination and how this is normal, but sometimes these complexes get deposited in tissues. So you can see here we have this complex embedded in the tissue. And what that does is it recruits your complement system. Remember, complement is attracted to the antibodies, and the complement will come in and basically start to do what they are supposed to do, which is destroy the tissue. The other immune cells will come in, right, like your neutrophils, that will also start to destroy the tissue. So it is an odd reaction where you have this immune complex formed. It deposits in tissues, it activates complement and inflammation, and ultimately it does destroy the tissue that the immune complex is stuck inside. So you can see that many areas of the body can be affected, from your blood vessels to the heart to joints to skin and kidneys. And so that is this kind of reaction. It's not a good thing to happen. It's categorized under type 3. So there's a couple kinds you should know about. And the first kind is called serum sickness. This is where you would get like an anti-serum to maybe a toxin. We talked about this in the vaccines. This is going to be basically a passive artificial immunity where you give somebody antibodies that were made in another person or another animal. And serum sickness usually arises when these antibodies are made in an animal. So you see here in this picture that for diphtheria toxin, they actually give the horse the injection of the toxin. The horse then goes ahead and makes antibodies against that toxin, right? So these are anti-diphtheria toxin antibodies. They take those antibodies, they bottle it up, right, purify them, and they inject the serum into your body. So this is a patient that has diphtheria. We want to prevent it from getting worse. We're giving him passive artificial immunity. And for some reason, his body will attack or form complexes with this rather than those antibodies doing their job. Complexes form and then they embed anywhere in the body. You can see this rash is one of those symptoms from serum sickness. So serum sickness is categorized as systemic because it can happen. The inflammation is all over the body, whereas there are other kinds that are more like organ specific. So usually, again, involves non-self proteins such as antibodies made in animals. And I'll say that, horses are used, mice are used, hamsters are used, rabbits are used. So a lot of different animals make these anti-serum for us. Or it could be if you have a chronic infection and you're continually releasing some antigens over time, immune complexes can form and they can sort of get deposited in areas of your body that they shouldn't be deposited in. So that's serum sickness. And then we have rheumatoid arthritis, which is a very unique immune complex. It has to do with one IgM, so you can see that pentamer, right? That's our IgM antibody. And then we have a IgG, all right? So for some reason, the IgG and the IgM come together and they form this complex. And then this complex, known as the rheumatoid factor, deposits in our joints. So our freely moving joints, where we have synovial fluid and synovial membrane. This can be the knee, the elbow, your fingers, any joint that you can think of that you can move freely has synovial joints. And so when this rheumatoid factor embeds in here, right, it calls for inflammation, it calls for tissue destruction. And if you are in a joint, we are talking about destroying that really nice hyaline cartilage barrier to allow our bones to move freely in the joint. The hyaline cartilage protects bone from rubbing on the other bone, basically keeping that joint healthy. So if you erode that, you're going to get arthritis. So rheumatoid arthritis is due to the immune system putting these rheumatoid factors in the joint, whereas other forms of arthritis can form due to wear and tear or other kinds of inflammatory responses. But this is rheumatoid arthritis specifically says that you have this immune complex in your joints. These are some examples of someone with rheumatoid arthritis for a long time. What tends to happen here is that the joints are so painful that the person will stop using them. And when you stop using them, the muscles will atrophy. So the finger muscles will atrophy, they get shorter. And so the hands will get sort of pulled in an awkward position because of those muscles shortening and becoming atrophied. And also the joints, you can see, are very swollen and painful. And so that is a hallmark of rheumatoid arthritis as well. Moving on to type 4. So type 4 is called delayed type hypersensitivity. And delayed, meaning that it's going to take a few days for it to develop and for you to notice that you have a hypersensitivity. And these are going to be things like poison ivy, poison oak, something that shows up a little bit later, right? Latex gloves can also often cause this kind of hypersensitivity. So it basically contacts your skin. And the first exposure, we are setting up a sensitization, right? First exposure to poison ivy does not result in reaction. However, sensitization occurs, and it leads to producing those memory helper T cells, and we're going to reactivate them. So the second time, so we could look at the picture for sensitization, right? The poison ivy has a very potent oil. The oil gets onto our skin, processed by a dendritic cell. T cells get involved, right? This is antigen presentation. The T cell gets activated. We have memory of this antigen, right? This oil coming from our poison oak. The second time we come in contact with poison oak or poison ivy. I'm saying oak because, ivy is more East Coast, poison oak is more West Coast. Then we're going to have these memory T cells, the cytotoxic T cells, really activated and forming this, a lesion, inflammation. So on secondary exposure, right, we are reactivating our T cells. We're producing inflammation. We're stimulating our macrophages, cytotoxic T cells, and we're having a response, basically inflammatory tissue damage if it's very, very severe and the oil can't be removed or whatever's causing that reaction cannot be removed. If you do get in contact with poison oak, you want to wash your skin immediately with soap and water and just hope for the best that you got it all off your body because that's what's going to cause the reaction. And this here is poison oak. Not fun. I've had it a couple times. Very, very itchy. Blistering does happen. And another kind of reaction might be if you have basically an allergy or sensitivity to like different metals. This is the nickel in a necklace. So sometimes people have, you can't really wear anything but pure gold or silver because if it's made with any other metal, it'll cause a reaction on your skin. So it's delayed because it does take time for T cells to get activated, right? T cells being activated, they have to come in antigen presentation, processing. So it takes a while for this to be activated, and it can take 1 or several days for you to get. So if you did come in contact with poison oak, take 1 to several days. It can take up to 5 days for that reaction to happen. So we look at that. Contact dermatitis, these are 2 examples of that. You just basically come in contact with something in your skin. So another example would be latex allergy. PPD skin test we'll look at, and then graft rejection we'll also look at. So this is the PPD test. This is the tuberculin test, otherwise known as the Mantoux test. And what this is doing is, everybody has to get this before school, before you start a new job. Make sure you're clear of tuberculosis. So the protein that they're putting in your skin is tuberculin, right? This is our protein from the Mycobacterium tuberculosis bacteria. And we're looking for an acute inflammation at the site of where you put it in. So because it's very local and very shallow, it does not become systemic. So we're looking just for a local hypersensitivity here. And why we have to wait 1 to 2 days is because it's mediated by T cells, right? A positive reaction is mediated by sensitized, delayed hypersensitivity T cells. So you have to read it about 48 hours later. If you read it earlier, it might be a false negative because you need that time for your T cells to get activated and to produce a lesion. Now, this is the thing. You would produce a lesion only if your T cells are sensitized, meaning that they have already seen the tuberculin protein before, which means you've been either infected with tuberculosis, maybe you didn't even know about it. If you've ever had tuberculosis in your life, you're always going to be positive for the tuberculin skin test because you have sensitized T cells. Another way that you can be sensitized is vaccination. So we do not vaccinate in the United States. We do not vaccinate for tuberculosis because it is not a big problem. It's not an endemic disease that many people have. It's relatively contained. So we don't give the vaccine for it for a number of reasons. The first reason is that the vaccine is actually not that effective. Let me just talk about the vaccine since I'm on it. The vaccine is called the BCG vaccine, and the BCG stands for Bacillus of Calmette and Guerin, which are the scientists that isolated this strain. So it's not tuberculosis, it's Mycobacterium bovis, which is a related microbe. It's a live, attenuated, right, culture, so it should give a good response, but it's not that great. So why some countries use this BCG vaccine is because tuberculosis is an issue. Many people have it, and basically it's more cost effective for everybody to get the vaccine, right, than it is to check everybody for it at some time. So again, the U.S. vaccine is currently recommended for only certain of people with high risk to getting tuberculosis. So here's why, right? We don't use a PPD vaccine regularly because anybody vaccinated will have a sensitized T cell, right? They've seen this tuberculin before. They're going to have sensitized T cells, and then they're going to show up positive. It's also, and so when it's positive, right, then the next step is to take an X-ray to find out if you have active tuberculosis infection. It's not evenly effective. It's known to be effective in children, but not so good in adolescents and adults. Sometimes it's very not effective. And for HIV positive children, because it's live attenuated, it can possibly cause disease by mutating back, right? A revertant mutation. So vaccine is good, and it's used in countries where tuberculosis is at a high rate. But since the US doesn't have a high rate of tuberculosis, we just check individuals to see if they had been sensitized. Okay, so back to this. If you have a negative test, your body has never been introduced to the antigen, no reaction. So no time in your life have you ever had the tuberculosis infection coming into your body. And here in the United States, we do not vaccinate. So there's no reason why your T cells should be sensitized. A positive test, right? We have buildup of fluid and cells to give a red bump. So then the next step is okay, you've been sensitized to it. Do you have an active case, right? Do you have an active case of tuberculosis? So then what they would do if you did have a positive test is to take an X-ray of your chest to make sure that it's clear, right? Because remember those granulomas can form in your lungs where your body is trying to wall off the Mycobacterium tuberculosis in little those granulomas. Those show up on X-ray. So if you have active infection, then those will show up on the X-rays, and then they can give you medicine for that. So they're saying young people because, if you're infected with tuberculosis and you're young, you probably, breathed it in, you got the actual tuberculosis bacteria. In older people, it may indicate just a hypersensitivity from previous infection, right? So basically, we might have an active infection, or maybe your infection's gone, but you have sensitized T cells because you had it a long time ago. So you really need to do an X-ray for anybody that does show up positive for a tuberculosis test or this tuberculin test. Okay, so we talked about the vaccine. And then this is the overview of the different types of hypersensitivity. So we talked about type 1, which is IgE mediated. Remember that this is just your allergy. It could be pollen. So, right, allergen-specific IgE antibodies bind to their mast cells via the Fc receptor. When the specific allergen binds to the IgE, remember we have to cross-link the IgE, and that induces degranulation of those mast cells. Those mast cells are going to pump out all those chemical mediators for inflammation, right? Prostaglandins, histamine, leukotrienes. And what our examples of these are our local allergy, and systemically, it's called anaphylaxis, right? You have anaphylaxis if you get hives all over your body, you start itching all over your body, and you might have a very profound swelling of your face and neck. And again, for anaphylaxis, the most common kinds of allergens that give the worst sort of allergic response are going to be injected or ingested, right? So a bee sting or like peanut allergy. Type 2, we have IgE or IgM mediated, and this is going to basically, this is the blood type one we talked about. So we're going to have binding of IgG and IgM. We're going to activate complement, right, which is going to lyse the cells. So we talked about the red blood cell destruction, basically the mismatch. And we also talked about hemolytic disease of the newborn. Type 3, IgG and IgM. This is our complex, right? We have a complex formed. In terms of rheumatoid, it is one IgM and one IgG, right? Complement activation again, inflammation, recruiting neutrophils. Basically, we have tissue destruction. And we talked about rheumatoid arthritis here, and we also talked about serum sickness, right? So we'll put serum sickness here, forming those complexes, binding to different areas of your body. And then lastly, type 4, mediated by T cells, right? B cell mediated, because we're talking about antibodies. B cell mediated antibodies, B cell mediated antibodies, and then the last one's T cells. T cells are delayed, right? Delayed type hypersensitivities, and these are due to our cytokines released from helper cells, and we also have cytotoxic T cells activated. This is contact dermatitis. We talked about that. That's going to be our nickel allergy or our poison oak. Type 1 diabetes, we'll talk about actually that in a little bit. And then multiple sclerosis, we're going to talk about it in a little bit. So these are also, so type 1 diabetes and multiple sclerosis, these are also considered immune diseases or autoimmune diseases. So that comes in your textbook under the autoimmune section. Okay. If you are very, very allergic to something, you don't know what you're allergic to, but you know something is driving you crazy, you can opt for an allergy test. This is an allergy skin prick test. So they take basically a large area, sometimes your forearm, sometimes the back of your body. And what they do is they put tiny, tiny injections of different antigens under the skin, just like the tuberculin skin test, and they look for a reaction, right? So here we have number 1, number 2, number 3, number 4. And so they're going to look for bumps, they're going to look for pustules, any kind of reaction, and then they can determine like what your body's reacting to, right? So here in this side, number 1, there's no reaction I can see. Number 2, number 3, number 4, reaction, right? Number 5, a little reaction. So they can, based on what they put into your skin, they can tell what you're reacting to, and then they can tell you like, yes, you are allergic to, pollen from this certain plant, or this protein from a certain food. So things like that. All right. So this is going to be, I'm just going to go ahead and talk about this for part 3, autoimmunity. So let's just cover autoimmunity first. Actually, let's end it.